Are you suffering from mummy tummy post-pregnancy? Well, if the answer is yes, then this video might be for you, as we tell completely what exactly are the causes and how to treat it. So do watch till end. I am Dr. Anmol Chugh. I'm a cosmetic and plastic surgeon, an expert in treating post-pregnancy makeovers, and today we are discussing all about mummy tummy post-pregnancy. So mummy tummy, which is loosely known as the mummy poonch post-pregnancy, is very common. Every female undergoes that sort of changes. It can vary from person to person. Now this is because of something known as diastasis recti. Diastasis recti, or the divarication of recti, is the looseness of the tummy muscles. Now each one of us has six-pack muscles. These are known as abdominal muscles, and post-pregnancy, when the womb enlarges, these muscles loosen up. Why? To accommodate the baby. In most of the cases, it goes back. The extent is made sure by something known as linea alba, which is in the midline of these two muscles. Now, if the separation is more, then the linea alba thins out and muscles separate apart. Also, it depends on how much pregnancy weight you have gained, plus what's the size of the baby. Is it a twin or it is a multiparous? Yeah, that means that you have previous pregnancy. So there are multiple factors that take in the form of diastasis recti. Now what problems it can cause? Most of the time post pregnancy, females experience posture changes, lower back pains. Thirdly, urinary incontinence, that means urine leaks on its own. Fourthly, they feel looseness of the surrounding skin also. And the most importantly, the concern is, doc, we have lost our pre-pregnancy shape and it's not coming back. Now these concerns are there universally. The extent can vary and it affects your self-confidence and self-esteem. Now how we can help you in that? Firstly, we want to assure you that with patience and proper diagnosis and treatment, this can be healed. Now, diastasis recti extent has to be determined by your doctor post-pregnancy. Usually, we suggest that at 6 weeks, you consult your doctor, be it a gynecologist or a plastic surgeon, to know the extent of diastasis recti. You can easily do an extent test of diastasis recti at home by using your two fingers. What you can do is, along the navel region, especially above the navel region, insert that in the midline and just check how much is the gap. It can either be for the knuckle or the finger based also. That gives you an idea of the extent of the looseness of the muscles. Initially, what we suggest are some exercises that you can do post your delivery, generally around 6 to 8 weeks. Now these exercises can be some sort of lunges, pilates also you can do, also along with that hinges and certain kind of squats also. Now these all should be done under a supervision of medical professional, so do consider taking a proper physiotherapist for it also. Along with that, you can wear the belt or the binder for some time, but we do avoid it for prolonged period because it can either cause a compression that in turn can be harmful. Thirdly, there are massages of the tummy that you can do post pregnancy to reduce the swelling. This is known as lymphatic massages and this can help in reducing the swelling. Fourthly, what you can do is practice breathing exercises. Now diaphragmatic breathing is very important. That means you're not breathing for your tummy. Diaphragmatic breathing is something that you are engaging your core muscles, that involves movement of the chest along with the tummy 360 degree. It is very important that you follow day in and day out. Yoga can also help in that. Now the fifth, which is most important, is making sure that you are doing some core exercises. Now with a schedule of a new mommy, it is understood that it is very difficult. Even if you're doing for 3 days a week, that's also sufficient. Do get the diastasis recti checked every 1 month or maybe 6 weeks so that you know the extent. Initially, when you activate the muscle, then there are chances that your diastasis recti will recover fully. But sometimes it might happen that even after 6 months, 7 months of trying, the diastasis recti extent is not reducing. Then also there are other options that can be considered. One such option is the tummy tuck, in which we take care of the loose skin also, we take care of the loose fat also. Along with that, we tighten up the diastasis recti, that means the abdominal muscles. It is done in hospital based setup, in an OT based setup. It requires certain kind of healing also. Therefore, it is always advised to follow a certain routine before the surgery, and post surgery also follow complete guidelines to ensure permanent results. Now, all guidelines are made to make sure that the extent of diastasis recti is reduced. Surgery remains the last option in terms of taking care of your tummy, but even before that, in pre-pregnancy stage also, you can take care of the fact there are certain exercise and nutrition that you can take care to reduce the chances of extent of diastasis recti. Now, if you have any questions related to mummy tummy or diastasis recti, you can contact us on this number. We will be happy to help you. Thank you so much for watching this video. Hope this was helpful.